Insurance companies have been granted far too much control over patient care over the last several decades. Nowhere is it more apparent than when physicians are asked to obtain pre-approval for guideline-based, medically necessary procedures. According to one survey from the Medical Group Management Association, 83% of those surveyed said that prior authorizations are very or extremely burdensome to their practice and their staff. Another survey conducted of physicians found that nearly 1/3 of doctors believe that spending time obtaining pre-authorizations actually led to adverse patient outcomes. Now, 90% of those practice managers surveyed indicated that the amount of pre-authorizations have significantly increased over the last year. To illustrate the sheer volume of this work put upon practices, there were 182 million pre-authorization transactions conducted last year alone. While Congress has given lip service to this issue by hosting a hearing with doctors in September, no real changes have occurred. In fact, the insurance company have actually lobbied Congress that these pre-authorizations are much needed and they reduce costs and prevent unneeded treatments. Personally, I find this practice offensive. Who are insurance company executives to decide who needs and does not need a medical procedure? Who are they to determine that a procedure is appropriate in the first place? Did they go to medical school? I don't think so. Have they ever looked a patient in the eyes and told them they cannot have a life-saving procedure done because it costs too much? I don't think so. They hide behind their paper. They hide behind their bureaucracy. Worse than the pre-authorization is the peer-to-peer consultation. As an electrophysiologist, I spent nearly a decade training at Duke Medical Center in order to become an expert in the implantation of pacemakers and ICDs, as well as performing ablations. When I have a pre-authorization denied, I have to get on the phone and argue my case for the procedure, which is based on American College of Cardiology and Heart Rhythm Society guidelines, to some idiot who has never even seen a pacemaker and almost always does not even understand how a pacemaker functions. Often these are retired pathologists, pediatricians, or other non-specialists that are making decisions about my clinical judgment when they haven't even seen the patient. In fact, an EP colleague of mine recently told me that he had to do a peer-to-peer consult to argue the appropriateness of an ICD implantation. When he began the consultation, the insurance company representative, who was supposedly a doctor, said he could not justify putting acid into a patient. The trick here is the guy did not even know that it was AICD for a defibrillator and not acid. This illustrates the level of incompetence and wastefulness that the reviewing doctors for the insurance companies have. Why do they hire these people in the first place? We cannot stand for this any longer. Insurance companies are working around the clock to avoid paying for care. Our patients and our employers pay insurance companies for coverage. The physicians that care for patients every day, by and large, provide evidence-based care and do what is indicated for patients based on the guidelines. There's always exceptions. It is insulting to me and frankly disgusting to have someone who has no knowledge of a particular medical specialty reading a script and making a determination of care appropriateness on a patient they have never evaluated and with no expert subject matter knowledge on the topic. Moreover, these reviewing MDs are actually compensated for not approving procedures. Our patients are suffering. Our staff is becoming overworked with dealing with pre-authorizations, and our doctors are wasting valuable time on the phone arguing with ignorant physician reviewers employed and incentivized by greedy insurance companies. Let's take medicine back. Contact your congressman or congresswoman today. We cannot stand for this any longer.